So you don't put TAHBSO. They think when they had their uterus taken out, they had everything taken out. The easiest way to question them on that is, did you take ovaries, did you take hormones after your surgery? Okay? Because if they put you on a regimen of hormones, then they took your ovaries. Okay, they like to keep the ovaries because they want the hormones of the female body to still do what they need to do. Okay? We're gonna find out how many times that they were pregnant. That would be gravida and parity. So if they were pregnant 6 times and they delivered 6 babies, it would be G6P6. G6P6. Now, what the doctor has written on the paper and what you ask the patient should be exactly the same things. It's up to you if you're doing the correct exam. If they say, it shows here that you're having pain on your lower right-hand side. No, my pain's up here. Well, what does that tell you? The wrong exam has been ordered. Okay? Go and get that cleared up with the front desk and have them call the doctor's office.
You gotta do something.
Yeah?
You gotta fall on the knee, put the toilet over, and abdominal or something. And it can clearly do on the knee.
Yeah, yeah. I mean, because we're the professionals, right? We're the professionals, not the front desk.
Right.
We're the professionals, okay? A lot of times, all it is the push of one button. You know, where you might have had someone at the doctor's office do that, and all they have is on-the-job training. They're not a professional at all. Okay, the doctor's not gonna check it. He's gonna assume that whoever he gives you the order to punched in the right thing. But you are the last change. Okay? So be sure you read the requisitions and you ask the patient, keep that communication open with your patients, and go from there. Now, preparation for a transabdominal exam is a full bladder. Here at Harris Health, we no longer fill their bladder full of water. We don't have them drink. We take the images as is because we're always going to do a transvaginal exam. Okay, always. The only time that we don't do a transvaginal exam is if they're not sexually active or if they say no. Okay? This is a retro flex uterus. You can see that there is a bend at the cervix. So it's retro flexed.
Thank you, ma'am.
Okay? Here is the bladder. Here's the cervix. Here's the vagina. Here is the fundus. This is anterior uterus, posterior uterus. Transabdominal exam. I can tell that by the footprint at the top. Anterior, posterior, superior, inferior. This also is transabdominal. This bladder is full, but it's still not over the fundus. It's not full enough. You can notice, because look here what happens. Ultrasound comes down, it hits a curved object, and what is this called now? Edge
Artifact.
Edge artifact. Edge artifact. So we can't evaluate the lower uterine segment or the cervix because we don't see it. Here we have a very full bladder, and you can see that we can see all of the uterus, the cervix, and the vagina. This is fluid in the posterior cul-de-sac. This would be the anterior cul-de-sac. This would be the space of Ritz's up here. Beautiful imaging, full bladder, it's over the fundus, here's the vagina, here's the cervix, here's the lower uterine segment, here's the body, and here is the fundus. Anterior bladder, posterior bladder. Anytime we do an exam, we want to practice ALARA. ALARA is as low as reasonably achievable. We don't want to talk to the patient with our machine not on freeze. Those sound waves are heating up the tissue inside the patient's body or my baby, if I'm looking at the baby. Now, there are no known bio effects, but don't be the one to make that known, okay? We always want to practice ALARA. And sometimes I'll take, if my arm is tired, I do take the time to talk to my patients. So what part of town do you live in? You have children? What kind of work do you do? You know, that gives me that few seconds to rest my arm because I tend to have problems with my thumb. Okay, if I have a long day, my thumb is usually the one that starts hurting. But whenever I talk to my patients, I make sure either my hand is lifted, the transducer's not touching the body, or I put it on freeze. Okay? So that way there's no ultrasound going into the body. We have to look at all the anatomy that is part of our protocol. We have to document our findings. Did I send y'all the worksheets?
Yes.
Okay. Those worksheets, are they still used in the clinical setting? Do they fill out those worksheets before they take the films into the radiologist?
Yeah.
They still do? Okay.
Yeah. That's nice.
So we document our findings on a worksheet, okay? Some places you'll be the only one there. You won't have a radiologist there. You won't have another sonographer there. All you'll have is an outpatient clinic where the doctor comes in once a day, usually after hours, after he's finished his other job, to read films. So everything has to be very, very specific. They have 100% confidence in you that you know what you're doing. Yes.
They document the findings on the requisition. That's where they write all their findings.
On the requisition?
Yes.
Okay.
And then she scans it, saves it, all that.
Okay.
Yeah.
Okay.
They don't have a special, I haven't seen.
They don't have that
yet.
special form?
Yes.
Okay, used to, you had to have the special form.
You do it, Smith.
I do it in Smith.
Okay.
Yeah.
So, that becomes part of their medical records. Okay? If that patient goes to court, your notes go to court with them. Okay? So make sure your notes are very, very specific and use the proper terminology describing whatever you see. Anechoic, hyperechoic, isoechoic, heterogeneous. You know, you're not there to make the diagnosis. You're there to describe what you saw. So use your terminology. We want to make sure that we clean the transducers between each patient. Just use, if you're at the hospital, I usually use the sheet and I'll clean my transducer off with the sheet.
But how about if they use some kind of a wet towel, is that okay?
Some places, I don't know what they're doing now. They're using a wet towel.
Yeah.
That wet towel is usually not big enough if I have a lot of gel on there. I usually will wipe it off with a towel and then do the wet towel.
But it's
Okay.
fine, right, like the wet towel?
Yeah, the wet towel is usually going to be a germicide. And that germicide has to be approved by the manufacturer of your machines. Not Clorox wipes.
Yeah.
Not Clorox wipes. Now, how many of you have learned in clinic how to clean the transvaginal probes? Oh, just about all of you have them. Okay, That is mandated by our infection control, department, so, document everything that you need to. Yes, it is a lot of steps, but if you wanna get paid, you gotta do the steps.
You have done it?
Yeah, I've done
Oh, maybe.
Yeah. Okay. So, benefits of a transabdominal is I can see the whole pelvis. Okay? I can evaluate a very large mass. With a transvaginal probe, I don't have as much depth, and, sometimes I can't get the whole mass in there. So, yes.
I have a question. If you have like younger age, about 16, 17 years old, and they're doing transvaginal exam, do I have to ask them like if they're sexually active?
Absolutely.
Even if it's not saying anything, like the doctor?
Absolutely.
So what is the
Because if they're
appropriate-
not sexually active, you cannot do a transvaginal exam.
So that goes with everybody that
Everybody
comes for,
from 10 years old on up. I ask everybody.
Yesterday,
everything.
one of the tech got a patient, she was 70 years old, and she was in ER. So she had a pain, and then when the tech took her to the room, the doctor just ordered a transvaginal.
Uh-huh.
And the tech was telling the, girl that we have to do that, the transvaginal, and explain everything. Then the girl said, is it necessary to do that? Then she said, yeah, because the doctor ordered that, and then the mother was keep asking, so, can we do, like, is it necessary to do that? After like several time of question, then the tech said, is there any problem why you don't want me to do that? Then the girl said that because, and then the tech asked, are you sexually active? And then she said, no, I've never had any sex. Then the tech changed the order. So
Yes,
she did
that's
the
correct.
Yeah, she just changed it to the
Yeah.
transabdominal and then explained that if she's doing the transabdominal.
And she changed the order because it's a different charge.
Charge, yes. And
It's a
then,
different charge.
and the tech was asking the girl that why the doctor didn't ask her, didn't ask her that is she like sexually active or no.
Why? Because they could care less. They don't even like to talk to the patients.
Yeah, they
It's up to you.
Mhm.
And I never ask in front of the parents because they're gonna say no. They're going to say no.
The mom was like,
So how you
Okay.
gonna make it like
she
private?
was asking.
Or
Oh, yeah, absolutely. Like, I'll say, like, the mother go, well, I wanna come with her. Oh, okay, you can come with her.
Yeah.
Okay, so I brought the mother in, and then I would take the girl out
Oh,
and say, take her to the restroom. I need for you to take everything off from the waist down, including your panties. And if you're on your cycle, I need the Tampax out, or I need your Kotex out. And have you ever been sexually active?
that was the last question.
Okay?
Yeah, because the doctors, they don't write every detail on the requisition.
Exactly, that's why it's up to you.
You think it's like.
Remember the story about the nun?
Yeah.
Okay, she was 50-something years old. My coworker assumed that she had been sexually active because she was in normal clothes. Okay, she was in normal clothes, but she was a nun. She had never had anything up there. And so, don't assume anything. And if you can't get rid of the mother, type it on the screen, turn it towards the patient and say, I need you to answer the question on the screen.
What if mom was like,
Oh, there's no way.
Mama, we
Oh, believe me, whenever my parents come in, I put them on the other side of the curtain as far away from the screen as I can.
But as you said, when they go to the bathroom changing, that's another
Then ask
way,
them.
yeah.
If you can't get rid of the mother, or say you have a young man that, his mother wants to come in with him on a scrotum exam. If he says yes, then I'll let him stay, but I put her on the other side of the curtain. Or I'll take her chair and face it the other direction. I'll let her in, but I'm gonna protect my patient's privacy. Okay? Because if it was my son or daughter, I'd wanna be in there. But I would also want to respect their privacy. You know, I'm not gonna be right up in their face. What do you mean you're sexually active?